Namaste everyone. This is Dr. Meenakshi. So today we'll discuss about the second point of Part A syllabus of Kaumarabhritya. So as you all know, I'm Dr. Meenakshi and I'll be dealing with the points of syllabus topic of Kaumarabhritya. So today's discussion is second point, that is scientific contribution of Kashyapa Samhita in Kaumarabhritya, because we all know that is Kashyapa is our father of Ayurvedic pediatrics, right? So, what all he contributed particularly in Kashyapa Samhita? Acharya Kashyapa wrote Kashyapa Samhita, and what all contribution he gave for Kaumarabhritya we'll see today. The existing presently available Kashyapa Samhita is probably belongs to 6th century BC of his preceptor Maricha Kashyapa, which was written by the guidance of his sage. We all know that, right? In before days, the knowledge how they were sharing in the form of Gurukul. One guru was getting up knowledge and he was sharing his knowledge to all disciples. On that way, the Maricha Kashyapa gave all knowledge to our Vriddha Jeevaka. Who is this Vriddha Jeevaka? Why he became Vriddha Jeevaka? We'll see the history. Actually, before, after obtaining the knowledge of from Brahma, Maharshi Kashyapa transmitted his knowledge to all the disciples. But on his disciples, one of the person was Jeevaka, by name Jeevaka, child Muni. What he did, whatever he got the knowledge from Maharshi Kashyapa, he started sharing in the form of written concept. He wrote a book, but all other acharyas or other sages, rishis who were present, they didn't accepted it. That by saying he was a small boy, how he can share his knowledge in the form of book. So what our Kashyapa did, he Jeevaka, that is Jeevaka did, he dipped in a Ganga river and came out as a Vriddha Jeevaka. So after he becoming Vriddha Jeevaka, all rishis accepted his book. And then our Kashyapa Samhita was published. But in course of time, this our Kashyapa Samhita was lost. And after some time, the Yaksha by name Anayasa got this Kashyapa Samhita and he preserved it. He didn't did anything, just he preserved it. After some days, by the name Vatsya, he was one of the pedigree of our Kashyapa only. What he did, he took this book from the Anayasa and he redacted it. Means he added extra portion, some missing portion in the form of Khilastana, and he redacted and published in 7th century AD. The present Kashyapa Samhita is the narration of Pandit Hariprasad Shastri based on the mutilated original text on Tala leaves in Panda script lying with Pandit Hemaraja Sharma in Nepal. What we know that, right? In olden days they were writing in on the leaves of some tala, for example tala leaves by laksharas or something, and they were preserving this preserved one. Our Hariprasad Sastri, he wrote in the form of book, and it is present with the Hemaraja Sharma in Nepal. Another Kashyapa Samhita is present in Neravi script at Saraswati Bhavan of Varanasi, and Yadavji Acharya of Bombay published another book under the name of Vriddha Jeevaka Tantra. These are the history wherever our Kashyapa Samhita is present and how we have it. Coming for Samhita and sthanas contains in it and chapter contains in it. There are 9 sthanas and 130 chapters. Actually, we have 210 chapters, but rest all are missing. So only 130 chapters we have presently. And like rest all, we have same sthanas like Sutrasthana, Nidhanasthana, Vimanasthana, Sharirasthana, Indriyasthana, Chikitsasthana, Siddhisthana, Kalpasthana, but only Khilastana is specially found in Kashyapa Samhita. In other Samhitas, we won't get Khilastana. Khilastana is only present in Kashyapa Samhita, and this Khilastana was added by Vatsya. And rest chapters, particular sthanas have particular chapters, like Sutra sthana have 30 chapters, Nidana sthana 8, Vimana 8, Sharira 8, Indriya sthana 12, Chikitsa sthana 30, Siddhi sthana 22, Kalpa sthana 12, Khila sthana 80 chapters. Materials, what all materials we have in the Kashyapa Samhita. Actually, these all we got to know that all Sutra Sthana and Dana Sthana are same as other sthanas, but only missing portion is added in Khila Sthana. And we have both the portions of pediatric portion and obstetric portion in our Kashyapa Samhita. Next is pediatric portion. What is this pediatric portion? That is, as we know, we have two portions, pediatric portion and obstetric portion. In pediatric portion, the following points are explained, like embryology, neonatology, growth and development, and eruption of diseases, teeth. Like in embryology, the Acharya explained 24 tattvas in embryogenesis, and the Shadbhavas are described. In neonatology, Lakshana Adhyaya of specialty is a specialty in pediatric because we want to predict the complaints of newborn, or we want to predict the future life of newborns, right? So Lakshana Adhyaya explained by our Acharya, especially for newborns. And in growth and development, he explained particularly samskaras, everything. But we miss a lot of portions in growth and development, like maybe mentioning of Karnapali, eruption, and diseases of dentition are explained, but some portions of growth and development is missing in Kashyapa Samhita. And another points in pediatric portion is Kshira doshas, that is materials available are very less. Vajra is a specialty of Kashyapa, that is antigen producing abscess in breast. He explained about this point in Kshira doshas. And Vedana Adhyaya. In Vedana Adhyaya, our Acharya explained particularly in which pain how the baby will react, because as we know, our childrens are paratantra, depending on other, they can't explain their complaints, right? So in which complaint how the child will react in about particular diseases, like from 30 to 32 diseases in Vedana Adhyaya or Acharya explained. For example, if the child is having like abdomen pain or ear pain, the baby will touch repeatedly the ear or abdomen wherever the pain is baby having. Or in headache, the baby may bang his head to hard to like hard portion, maybe wall or something else. These all explained in Vedana Adhyaya. In injury to toddlers, to stop bleeding, cold packs and the cauterization are advised. Dressing is advised with Madhusarpi. These are special points of Kashyapa Samhita. And the infections like Graha Rogas, the Acharya Kashyapa explained, but Doshaha and the Lord of Upagrahas producing Ganda is a speciality of Kashyapa. And fumigation, that is about particularly Dhupana for newborns, he explained as a separate chapter. And next point about pediatric portion is diseases in children. Various diseases are described like Charmadala, Pratishaya, Yakshma, Sannipatada, Jwara, etc. Use of Katutaila Kalpa in Pliha Roga and Pippali and Nagabala in Raja Yakshma is special point of in diseases of children. And use of zinc and Mamira in eye problems, and description of Pakka Roga and use of Trichakra Ratha in Pakka Roga is a special point of Kashyapa Samhita. And Chaturpatra Kalpa in Vasti is an exclusive contribution of Kashyapa Samhita only. And moving towards the dosage of herbal drugs, how our Acharya explained, like posology, specific posology means the dividing the doses of medicines or herbal drugs to the pediatric child group. That is, The posology has been discussed in detail not only for drug administration but also for the Shodhana Dravyas. The Kalpana mode of action and the age is specially considered before deciding the dose. And starting with Vidanga Phalamatra in first month is a good contribution, whereas in rest all others Acharyas explain dividing the dose from child group, like 1 year, 2 year they started. But Acharya Kashyapa explained particularly from first month of baby's born, he started dividing the doses. So Shruta mentions that a pinch of powder as we get in 2 fingers, it is advised. In Kshirapa, as I said, rest all other acharyas explained a pinch of drug or herbal powders according to age. Like Kshirapa means whole Kshirapa from birth till 2 years. But whereas our Kashyapa explained month-wise dividing the dose. And Kashyapa conceived the idea of formation of new drug with different rasa and gunas, 8 varieties of Svedana to neon, especially Hasta Sveda. 8 varieties of Svedana explained by Acharya, especially Hasta Sveda for newborns. This was about the pediatric portion, whatever we present in Kashyapa Samhita. Moving towards the obstetric portion, the gynec portion is missing in the available text. Most of the gynec portions are missing, but whatever we have is infections in women destroying the fetus or newborn are described. Kashyapa explained that the diet of the pregnant woman should be sufficient enough to nourish Garbha, Sthana, and the body of the mother. Certain antenatal diseases are described under Antarvatmi Chikitsa, and normal diseases of a woman not related to pregnant but when manifested in a pregnant woman like Kamala, Pravahika, these all he explained, and with treatment. Mudagarbha is missing in the available text explanation, but Mudagarbha name is mentioned, and the placenta previa is well described by saying that delivery is the possible only when placenta is not spread in the dilated portion of the cervix. And position of the body in delivery is described as Upavishta till internal rotation, and then lithotomy position is described as Paryaka Paryakamaru Hetu. Like, see, he even explained the position of a woman while the delivery. And Sutikopakrama and Dushprajata Chikitsa are well attempted. 3 wonderful kalpas in gynec practice are described as Shatapushpa Kalpa, Lasuna Kalpa, and Shatavari Kalpa. Shatapushpa Kalpa for menstrual disorders and in ovulation. In many cases, it is found to bring ovulation in cases of polycystic ovaries and regulate menses. Lasuna Kalpa in removing tubercular blocks by dissolving the fiber tissues, and Shatavari Kalpa to tone up the body and bring back the teenage changes in a body in elderly women. These kalpas, specially Acharya Kashyapa explained in gynec portion, and even now it is in practice and we have a good result of it. So this was about the second point of part A syllabus of Kaumarabhritya subject. So in next video, we'll move on to the next point of part A. This was about the scientific contribution of Kashyapa Samhita or the scientific contribution of our Acharya Kashyapa, especially to the Kaumarabhritya. Thank you.